I didn't know I was going to be on too.
Hi, my name is Cheyenne Lowe. I'm an RN and I'm going to be doing an assessment today. The first thing to do any assessment is to always wash your hands. So I'm going to wash my hands.
Yeah. Well, are we going to see? We need it just something.
Okay, hi Alva, my name's Cheyenne and I'm going to do an assessment on you today.
Okay.
Alright, so what's your name?
Alva Flasher,
What's your date of birth?
6/8/44,
What's the month?
June.
And who's the president?
Trump.
Yep, so she's oriented ×4. Just doing the first assessment, her skin tone looks good. She doesn't look like she's in respiratory distress. She's not blue or anything like that. Her face is symmetric, no drooping. Her hygiene is good. She doesn't have any physical deformities. So now I'm just gonna check your head for lesions or bumps. And
You'll get stuck in my hairspray.
and I don't see any lesions or bumps or moles or anything like that. If she were to have a mole, we want to look for the border, the symmetry, and the color to check to see if it's possibly like skin cancer per se. So can you smile? We're checking for symmetry to make sure that if she doesn't have a facial droop. If she were to have like a facial droop with a smile, that could indicate a stroke, or it could even be Bell's palsy, which is nothing to worry about. But as far as what I would worry about, the worst thing would be stroke. But she has good symmetry. Close your eyes tight and then open them, and she was able to follow commands, and she had symmetry with being able to do that. It's another thing we check for with stroke. So now I'm going to check her eyes, and I have a pen light, so we're gonna do Perla. So I'm going to look straight up at me, and I'm going to check to see if her pupils constrict whenever I put the light in them. And they are, so they're reactive to light, and they're round symmetric, both are the same size. I'm just going to have her follow the light to make sure that her eyes don't quiver or shake. So just follow the light. And there was no quivering or shaking, so that's a good sign. I don't see any redness, swelling, or irritation, which that could indicate things like allergies, or it could indicate like dry eyes, allergies, could indicate conjunctivitis, which I don't see that she has red eyes to have conjunctivitis, which would be pink eye. So how are you feeling today?
Good.
So her affect is good. She's appropriate, calm, cooperative, and pleasant. So I'm gonna have you stick your tongue out to check your cranial nerves and stick it from side to side. She's able to do that, so I would say that her glossal nerve is working very well. And then open and close your mouth. And I don't hear any clicks in the jaw, and she's able to do that, so that would be the trigeminal nerve. That must be working. Do you have any problems swallowing?
No.
So I don't foresee her having any dysphagia as far as eating Do you eat independently?
Yes.
Yeah. So I'm going to just look at her ears, push behind for tenderness, push on the tragus for tenderness. I don't have an otoscope with me, or else I would look to see about the tympanic membrane. If it were to be like red and bulging, that could indicate infection, but I don't have one with me today. The doctors generally have those and they're pretty expensive, so I'm going to palpate and look for lesions, bumps, again, checking for moles and things, for skin cancer. And then, does it hurt when I push there?
Mm-mm.
And does it hurt when I push there?
No.
Okay. Now I'm going to check her nose, and it's symmetric, and she doesn't have a deviated septum, and there's no drainage. So I don't think that she has any sort of infection going on. And stick your tongue out again. I'm just gonna check for lesions, bumps, and then I'm gonna shine my light in here and check your uvula. And everything looks good. Nothing's red or swollen looking. And she doesn't have any white patches on her tongue, so I don't think that she has thrush. No drainage or redness, so I don't think that in an infection. So now I'm going to go over her neck. I'm gonna check for her pulses. You never want to do them both at the same time, because that can make someone feel dizzy. I feel that they're both palpable, and now I'm just gonna feel for like her lymph nodes. Nothing seems to be swollen, and her thyroid doesn't seem to have any swollen parts or nodules. So now I'm going to, also her trachea is midline and not deviated whatsoever, which if it were to be deviated, that could indicate a tension pneumothorax. So I don't think she has a collapsed lung. So I'm just gonna check your arms for tears, bruises, or lesions. And I don't notice that you have any tears, bruises, or lesions on your arms. And also still checking for moles for skin cancer as we're going down the line. And then I'm gonna have you lift your arms straight out in front of you, and she can lift them both, and she's not having any arm drop, which indicates that she has good neurofunction and no sign of a stroke again. So can you lift up on my arms? And can you pull down on my arms? She has good strength. And then just grip my hands. And she has good grips. So that means that she, and it's both are equal. So she doesn't have a deficit in strength for one or the other. So I'm going to check her hand joints for like, to see if maybe she might have a little bit of arthritis.
Probably.
So her knuckles are a little bit swollen, so it indicates that maybe she has a little bit of arthritis. And I'm going to check her capillary refill. So what you do for capillary refill is you look on the fingernail, you press down, and then hers is less than 3 seconds, so that's really good. That indicates good circulation. And then it's always best to check for skin turgor, not on the hand because it can be slower, but on the mediastinum, so it's like right here. And she has good skin turgor, so I don't think that she were to be dehydrated. If she were to have slower skin turgor, that could indicate dehydration. So I'm going to feel your radial pulses for circulation. I would say that they're both +2, so that's good. That indicates good circulation there. So I'm going to have you lift your arms up. I'm going to do range of motion now, so lift your arms above your head. Whoops. And then I already did the Palmer grass, and I did the pushing on my arms and lifting against. So now we'll do abduction, so put them close to your body. So she has good adduction and abduction and good range of motion for her arms. So now I'm going to get my ears on and listen for carotid bruits first, so that's on the neck. And a bruit would be like a buzzing sound. And I don't hear any bruits in her carotid arteries. So now I'm going to listen to her heart. Okay, so I'm gonna listen to her heart now. So this is, I'm listening for the S2 sound right now. And now I'm listening to the S1.
Yes,
These are the two normal sounds. And now I'm going to listen to the point of maximal impulse, which is in the 5th intercostal space. She does have a murmur.
Did they say what kind of murmur you have?
They just always told me I had a heart murmur. They said it won't affect anything, but
You should know what kind. There's a few different murmurs.
okay, I'll ask her in a moment.
Yeah.
No, I was told that 20 years ago, longer than that.
Mm-hmm.
I was told that when I was just a kid,
Okay.
when I had my physical at school,
Mm-hmm.
and Mom took me to the family doctor, and he said he couldn't find it, and they figured I was just scared and, upset over getting a physical. That's when they used to do them at school. And
Oh yeah, they used to do when I was young too.
yeah. And then when I went to work for Kurtz Brothers, the one summer, you had to have a physical, and Dr. Bell, I think he was the doctor. He was a heart doctor, and
Oh, okay.
but he said it's nothing to worry about. He said it will never affect anything you do. So
I bet it probably is a tricuspid valve one then. Because generally they don't affect anything, but a mitral valve one will.
Right.
Now I'm going to listen to her lungs, anteriorly and posteriorly. So I'll start with posteriorly, and the top of the lung is the apex and the bottom is the base. So I'm listening to the apex right now. Deep breath in out. In, out. In, out. The right lung has 3 lobes, so you listen in 3 spots, and then the left lung only has 2 lobes because it has to have room for the heart, so you only listen to the top and the bottom. Breath in out. In out. In and out. Lung sounds are best heard on the back because with females they have breast tissue, so you have more that you have to listen through. But on the back, of course, you don't have breasts on your back, and it's generally less adipose tissue is there, so it's easier to listen on the back. So now I'm going to move on to listening to her abdomen. I'll listen to bowel sounds first before palpation because she might not have bowel sounds, but then I might palpate them and then she might have them because I'm moving her bowels a little bit with my hands. So you always want to look first, then listen, then feel. Also, you want to do that in case there were to be pain because you want to do the least painful thing last. So I'm going to listen to your belly.
do I need to stand up?
you know.
Okay.
So she has good bowel sounds in all 4 quadrants, so that's good. Now I'm going to palpate to see if she has any pain. Did you have any pain with
No.
any of them?
No.
So no pain in all 4 quadrants. I'm going to listen to like the bottom of her mediastinum for the aorta to listen for bruits, as far as because that's where her renal arteries would be as well. So I don't hear any bruits in her as far as a bruit for like her renal arteries or for her aorta. So I don't detect her having like an abdominal aortic aneurysm. So now I'm going to check her legs for lesions, bruises, and scars, and I'm not, for privacy purposes, I just asked her to wear she's modest, so I just asked her to wear shorter pants to be able to check her lower legs.
Want my shoes off? Want my shoes
Oh,
off?
yeah, probably. I'll have to check your pedal pulses.
Okay. Yeah. This is my weigh-in. Close.
That's a good idea. Use the same clothes.
Yeah. I do, and I use, and I don't eat much, so when you did my belly, I thought it's probably growling. I never eat much when I weigh in.
Okay.
Okay.
So I'll be checking popliteal pulses, pedal pulses, edema, lesions, bruises, scars. Okay, I guess I won't need my ears for this. So I'm just going to check her legs for lesions, bruises, or scars. And I do notice that she has some varicose veins, a little bit, which is to be expected. I have varicose veins myself.
Yeah.
Yeah. So I don't notice any bruises or lesions, and I don't notice that she has any edema whatsoever. So I'm going to feel behind her legs for her popliteal pulse. And she has one in both, and they're +2 and equal. So now I'm going to feel the pulses in her feet. And again, they're +2 and equal. So that says that she has good circulation. And then while I'm down here, I'm going to check her capillary refill in her feet, which is less than 3 seconds. So that indicates good circulation to her feet. So I'm going to have you pull your legs up against my hands and now pull back. So she has good strength in her legs. And now put your feet straight. Now push on them like you're driving. And now pull back. So she has good range of motion. She's able to walk, has an equal steady gait. No drooping, no foot drag when she walks. So that indicates good range of motion for her legs. Now I'm just going to do a foot check. She's not diabetic, but on a diabetic person, you definitely want to do a very thorough foot check because they could have a sore and they might need to go get that checked because sores on diabetic feet can lead to toes going missing and lots of bad things. So I'm going to check in between her toes, and I don't see any sores or lesions or any athlete's foot or anything like that. And then always check the soles of the feet too, and they're both good as well. So okay, that's it.
Okay.